and your nurse educator. So today, it's a different day. It's a day that I'm going to address some questions, some comments, dahil may mga problema na naman about breastfeeding. So it's summertime here in Canada, almost summertime. I'm very excited dahil this coming summer, may magaganda akong mga plans about what are the things that I'm gonna be teaching you, either pregnancy, breastfeeding, formula feeding, how to raise your kids, etc. So today, I'm going to devote my time to be very thankful sa mga viewers ko, subscribers ko, all the new. Thank you for following me. Salamat sa mga comments, salamat sa mga atensyon na binigay nyo sa video ko, that some of you really appreciate the teaching that I have provided. Nakakataba ng puso when you find some na may mga taong na-appreciate yung mga teachings ko when it comes to either your bottle feeding or your breastfeeding or sa mga challenges that you're facing right now. I'm very grateful that I have this chance to show my skills, to share my knowledge, dahil alam kong ako lang siguro ang lactation consultant na Pilipina na gumagawa ng ganitong mga teachings para sa inyo, para makatulong ako as much as I can sa mga problema nyo when it comes to breastfeeding. But always remember that teaching that I've given to you are purely general information that minsan hindi it doesn't suit you, it doesn't apply kung no matter how you try. So you always need to consult your healthcare provider if you need assistance, okay? Now, again, thank you sa mga subscribers ko. Maraming salamat. And for those of you who really learned something from the videos that I posted. Okay, so I'm gonna go to this first question na I think nasagot ko na si nanay, but I just want to share some of the information that I know about this question. So one nanay is asking if it's safe for her to take glutathione while breastfeeding. Safe ba daw ang even if you're breastfeeding and you're taking this glutathione? So ako'y isang nurse. Ako'y isang nurse educator. Ako'y isang lactation consultant. Hindi po ako doktor. Okay? Based on our study, anything that you take in, medication, any supplement, halos lahat ng medication ay may mild, medium, moderate, or severe side effect. Iba't iba. It can be severe, it can be mild, it can be moderate, it can be tiny little minute side effect doon sa milk ninyo, doon sa breastfeeding ninyo. If you're taking anything, either medication or supplement. Wala sigurong even over-the-counter medication, kahit medication for sakit ng ulo, medication for colds, medication for this medication always have side effects. Minor side effect, moderate side effect. So, dito sa question na ito na, safe ba pag uminom ka ng glutathione? My answer is, I cannot say if safe, I cannot say if it's unsafe. Why? Kasi iba't iba. Every person is different, okay? If you're taking this medication, depende sa dosage ng medication nyo, kung anong sabi, whatever is the healthcare provider's information for you, especially if you're breastfeeding, remember to do your own research. Why? Hindi lahat po, it's not all healthcare providers are lactation consultant. Iba ang pinag-aralan namin as a lactation consultant. We study on the side effect of anything, medication, supplements that you're taking in that can affect your milk. We know if it's too much, that can really trigger some side effects para sa baby. So, if you are not sure, lalo na if your healthcare provider has no knowledge about lactation consulting, so your healthcare provider probably is just telling you that, go ahead, you can take this, it's safe, but yet you're not aware of the side effect of it. Be responsible kung ano yung role ninyo to find out the side effect of this medication. Role nyo yun, okay? There's so many resources you can use. Excuse me. You can use any resources as long as it's credible resources when it comes to checking the side effect of anything that you take, not just supplement, any medication that you take. It's always good to have at the back of your mind that if you're taking this medication, are you putting risk of your baby, that the baby is breastfeeding right now? So, lagi niyong pag-iisipan kung ano yung tinitake niyo, kung anong nakakasama ba yun sa baby niyo o sa sarili niyo, okay? Alam kong maraming mga Filipino na talagang nai-influence talaga when it comes to taking mga supplements, okay? Nakikita nyo everywhere, social media, mga promotions, commercials, TV promotions, nakikita nyo yan, and it really influences people to gaya-gaya, okay? Na minsan, you're putting yourself at risk. Now, especially if you're breastfeeding. So, you have to make sure that do your own research on what's safe for you to take while you are breastfeeding. And it's always good to consult other opinions from other healthcare provider. Itong sinasabi ko before, it's always good to have 2 healthcare providers, at least 2 healthcare providers. Don't rely on one. Because if you're not happy with the healthcare provider that you have right now, you always have options to go to other healthcare provider. Kasi minsan, in my experience, dahil nakaranas na rin ako na mag-consult ng mga healthcare providers yan, there are times na parang minamadali ka lang, they're not giving you the right information, they're not giving you good information, nagmamadali sila because it's just the way na para bang they're just taking advantage doon sa posisyon nila when it comes to giving some advice para sa mga nanay. Minamadali ka, hindi na-explain, hindi pinapaliwanag, and then when you go home, you get confused. Dahil you're supposed to ask these questions, hindi mo na naitanong because the doctor's rushing, nagmamadali, dahil maraming pasyente, and so on. So if you're not happy with your healthcare provider right now, go seek another information from other healthcare provider that you think will help you or will be more client taking care of you and considering the client-centered care na tinatawag, okay? Kasi mahirap yung hindi ka satisfied sa sagot ng mga doktor nyo dahil sarili mo yun eh, baby mo yun eh. Mahirap pag kung anong mangyayari man and then later on malalaman mo na lang na may reaction pala si baby. So always good to check, double check, do your own research before you even do anything when it comes to taking any medication. So I hope I answered that question really well. May isa pang nagtanong sa akin about, ito'y kalimitang nangyayari din eh, about medication para sa maintenance ng hypertension, maintenance for diabetes, maintenance ng iba't ibang, let's say, antibiotic dahil sa infection. So, those kinds of medications, it's always good you do your research on it, kung ano yung mga side effect, dahil minute side effect of it would really sometimes pass into the milk. Average, average ha, general information, average about 1 to 2% of this medication will pass into your breast milk. Now, again, I've mentioned this before, if you're taking this medication after you breastfeed, so the next feeding time gonna be probably after 2 hours again, so at least yung half-life ng medication is not as high dun sa pag nagtitake ka ng medication and then you breastfeed. So there are some doctors who would say, okay, take this medication after you breastfeed, so it's gonna take you 3 or 4 hours and then that's the time you can breastfeed. So it's still safer as compared to breastfeed right away, then you take this medication, after you take the medication. So, lagi niyong konsultahin ng doktor niyo. Huwag kayong mahiya sa doktor niyo magtanong dahil nagbabayad kayo. If it's free, government is paying them. So it's always good, take advantage of that, na magtanong kayo kung ano yung dapat yung tanong. Kailangan nyo yung tama, yung makakuha kayo ng sagot na satisfied kayo dahil sarili nyo ito at baby nyo itong pinag-uusapan natin. So I hope you learned something from this video. Do your comments kung ano yung mga experiences with your healthcare provider, anong gagawin nyo when it comes to, let's say, you're having diarrhea and you're taking some medication or you're having some infections na you're worried about your breastfeeding. Are you gonna be pumping and dumping your milk, throwing away your milk? Or are you gonna be just breastfeeding continuously? Or you're gonna be doing skipping for a few days while you're taking the medication para save si baby? So these are the things that you need to ask to your healthcare provider. And you know what? Itong sabihin ko sa inyo. Doctors' offices, especially for pediatricians, may mga certification silang nakasabit eh. Look into their walls kung may nakalagay ba doon mga breastfeeding courses or lactation consultant ba sila. Dahil makikita niyo sa mga doktor na may background sa lactation consulting katulad ko, na they have better opinion, they have better advice about the risks and benefits of maybe continue breastfeeding, discontinuing breastfeeding when it comes to taking any medication. So be vigilant, be observant pag nasa loob kayo ng clinic ng mga doctors nyo, kung ano yung nakasabit sa wall nila mga certificates. Kasi normally, kung meron yan sila mga certificate about this and that, nilalagay nila yan sa mga clinic nila to prove na certified sila sa ganito. Again, I've said this before. I've trained so many nurses and doctors when I do conference workshops in the Philippines. Kalimitan sa mga doctors na lumalapit sa akin, mga nurses, kulang na kulang talaga sila sa knowledge about breastfeeding and breastfeeding problems. So it's always good that I'm here to share you some of this information, but it's always good as well to consult your doctor if you have any issues. If you're not satisfied with that doctor, you can always find other doctors if possible. So thanks for watching. Please stick around, more videos to come. Please share this video, continue to subscribe dahil marami akong may share pa sa inyo. Thanks again. Bye for now.